we will have a presentation from Dr. Karl Hanson, who is a renowned researcher, psychologist, and expert in risk assessment. Dr. Hanson, we will pass to you.
Okay, well, thank you very much for the introduction. I'm delighted to be here. This is an important topic. There's lots to talk about. I will get started by giving some observations and thoughts on the issues, and then we'll hopefully continue the conversation after that. So how do societies deal with crime, and with sexual crime in particular? There's no one way of doing it. There's lots of different choices, and different societies at different times have done different things. And the US in particular has done different things with sexual crime over the years. And in fact, the response to sexual crime has changed significantly in my professional career. I started out in the 70s and 80s, I'm still here, and the things have changed. And so one of the things that you should think about is, whatever it is we're doing, whatever it is that we're advocating for, are experiments, essentially. They're social experiments. If we do this, does it make the world a safer place? What is the outcome? What are the costs? And I think hopefully this session is the time to reflect on some of the decisions that have been made and their consequences in current sort of approaches to dealing with sexual offending in the United States, and I guess Connecticut in particular. So I'm going to start with a little bit of a history. Going back into the 1960s was a time when public interest started to develop in child physical abuse. So the issue was children who were being physically harmed by their parents. And it was an emerging issue. People were recognizing it, and people were trying to wonder what to do with it. And it's interesting that the first case of convictions of parents, essentially, for child abuse were not under child abuse laws. They were under prevention of cruelty to animal laws. It was in the UK, and the UK had laws against being cruel to animals, but they didn't have laws about being cruel to children. And so the first prosecutions were actually done within the context of prevention of cruelty to animals. The laws changed. So we recognize now that you shouldn't, break the bones of your children, even if you feel like it. This is not something that we want to be doing. So the laws have changed. Now it's become pretty much integrated into social standards. At the same time, or shortly thereafter, there came the issue of child sexual abuse. When I was studying in the 70s and 80s, child sexual abuse was considered very rare. One of the things that would happen, very odd, unusual cases. And what happened during that period of time is people started taking a close look at, well, how common is it? And there were a number of very important victimization surveys, which basically showed that child sexual abuse was far from rare. It was very, very common, in fact, that a significant minority of both women and men had been sexually abused as kids. And I was around during that time, and I thought, oh, does that seem right? So I just started asking my friends, about this. I do these sorts of things, and yeah, there's about 1 in 3 or 1 in 4 had a history of sexual abuse, and this wasn't being talked about. There's very few comments or criminal justice intervention. And often the laws weren't really quite laws. The cases that I was involved with early when I was working were charged under contributing to juvenile delinquency. So there was no laws against men having sex, this is in Canada at the time, with boys, but it was considered indecent. In the 1980s, there was a increase in the women's power and voice in the political process, and which came to a wide recognition of the harmful effects of and the prevalence of sexual abuse of women. And it was going on essentially unwanted, sexual behaviors and touching. My mother, when I started talking to her about these types of things, said it was just, she worked as a young woman in a oil refinery. And she said that you just had to, dodge and duck because there was so much sexual abuse going on. Some of that still continues, but less so. But it became much more of an issue. And so in the 1980s, the issues of sexual assault of women raised way up as a criminal justice issue. And there was also a major change, which I think is a constructive change, from sex offending laws, which were mainly based on indecency. They're icky things that we didn't want people to be doing, to laws that were based on violations of sexual self-determination. So in other words, the people should have the right to choose what types of sexual things they do. And this led to changes such as made it possible to sexually assault women in your spouse in relationships. And we also decriminalization of certain forms of consensual behavior, such as sex between men, which was often illegal between them. In the 1990s, there followed an explosion of, I guess, criminal justice activity. So there's lots of cases. There's a lot of new legislation that was enacted that would criminalize and enforce the criminalization of sex crimes, which paradoxically was going on just about the same time as the actual rates of sexual offending was going down. So the incarceration and the criminal justice interventions are going up in the mid-90s, while the actual rates in most both Canada and the US were actually going down somewhat. Now, if you look at the criminal justice response, it serves many functions. One of the function is I guess, a retribution or punishment function. So people are being punished for bad behavior. And this is one of the functions that we use criminal justice for. We don't want people to do things, and we punish them if they do. And so one of the troubles with retribution as a guiding principle of criminal justice is it's very hard to determine what's an appropriate punishment, so to speak. So if the standard punishment is, say, 2 years of prison, for example, and a person goes to court, and in their case, they get less than the offender in that case gets less than 2 years, they may feel that their case isn't being taken seriously. And if they get 3 years, they may say, well, yeah, that's, my case is being taken more seriously than if it was than average. And then 3 years becomes the standard. And then it becomes 4 years, and then it becomes 5 years, and then it becomes, lifetime, becomes civil commitment, it becomes all sorts of things. And this spiraling of offenses has been happening very much within the realm of sexual offending in the last 20 or 30 years. This isn't the first time that, criminal justice offenses have spiraled into sort of very high rates. In the early 1900s in the UK, for example, there were 220 offenses that justified the death penalty, including things such as spending, time with gypsies, or theft, or vagrancy. If you're a recidivist vagrant, that was a death penalty offense. And so you end up with situations where there was a pushback in the UK, because even though people were sentenced to death, it was really hard to actually kill them, because you looked at the person, you looked at the thing, and it says, I don't want to kill this guy. And the actual application of the death penalty was actually quite, was much rarer than the actual sentences themselves, which were required by law. And many people recognize that the application of the law sort of brutalized not only the individuals affected, but also brutalized the society. It became a really rough place with a lot of people killing a lot of people, which we don't want to have happened. And so one of the things, if you're not going to let punishment spiral out of control, is there has to be some level of restraint. If somebody does something, truly horrible, and there's lots of truly horrible things that people do that in some sort of, maybe in some sense, big sense, justify really, really, severe sanctions, there has to be some level of restraint where you pull yourself back and say, okay, even though he deserves whatever, I'm going to give less of that, or we're going to give less of that. And we're going to try to change the person or protect ourselves rather than retribution of punishment. The old saying that an eye for an eye, makes the whole world blind. There's no winning eventually in that one. It just spirals out. So I think there's possibility to restrain the use of retribution. It doesn't mean you don't do anything, but it does mean that the justification is different. And so in some ways, there was a switch also in terms of criminal justice policy in the 1990s, where the increased focus on public protection, which I actually support. And I think that public protection should be a primary goal of criminal justice. Public protection, though, needs to be linked to evidence. You can't just assert that something actually is helpful. And, as you want people to feel safer, be safer, you want fewer crimes, and you also want greater liberties. So one way to have fewer sex crimes is for people to never leave the house. Well, yes and no, but you want people to feel free to, go about their business and feel safe in that. And that's what we want to do. And I think we can evaluate, current practices against those sorts of standards. So criminal justice, I think, is an important part of the response to sex offending, but it will never be the response. The issue is that of the people who come into the criminal justice system for a sex offense, 70 to 80% have no prior history of sexual offending. So these are people who are basically first-time sex offenders, so to speak. And so these individuals will be coming into the system from somewhere else. So no matter what we do with the people who are currently in the system, the new cases coming in will always come in. And this makes perfect sense because, crime, and particularly sex crime, is committed by the young. So there'll always be a generation of young people coming up. Some of them make horrible mistakes, and you'll have to deal with them. And the older people tend to learn, and they tend to stop. So, the criminal justice, good, bad, or ugly, isn't going to make a huge influence on the actual rates of sexual offending, because a minority of people have have a history of sex offending in the criminal justice system. So by the time they get into the criminal justice system as well, the tragedy has already happened. The person has been victimized, and so the victim has to deal with whatever consequences, psychological or physical, from that. As well, the offender has to deal with whatever consequences. There's the consequences imposed by us, the powers that be in the criminal justice system, but they also have to live with their own guilt and responsibility, which is something which is not easy enough to do. They know what they've done. They know it's not right, and they have to live with that as well. So once you get to the point of a criminal justice charge or conviction, you know that you're already in a very well down the process. So if in the healthcare system you want a healthy country, you're dealing with people at the stage of cancer diagnosis, at the stage of exercise and good diet. Another reason why the criminal justice response, whatever it is not going to make a huge difference in reoffending rates or public protection is that most individuals who are convicted of a sex offense stop. That the recidivism rates are somewhere between 10 and 20%, which means that 80 out of 100 or 90 out of 100 will stop anyway, regardless of what you do. There's no relationship between the length of the sentence. Long sentences and short sentences make no particular difference in the likelihood of reoffending. Community sentences versus prison sentences make very little difference. What you're ending up with is there's some people who do reoffend, and there's something you need to pay attention to, but it's a small proportion of everybody in. So if you just catch them give your, moderate level of punishment or whatever it seems, they'll probably stop. And I think that's something worth important. And I'm a strong supporter of the use of the criminal justice system to address the problem of sex crime. But I don't think we need to be very severe about it, because the severity has costs without benefits that are easily recognized. If you do end up with people in the criminal justice system and you want to reduce their likelihood of reoffending, then it really helps to apply what's being considered the risk-need responsivity model of intervention. And there's three principles here: risk, need, and responsivity. I'll just briefly describe each one. And there's good evidence to support these as sort of almost necessary conditions of effective correctional rehabilitation. Risk refers to the risk of reoffending varies amongst people with a sex offense or any offense. Some from very high, some down to very low. And the very low people, you don't need to do anything with. They are not likely to reoffend anyway, regardless of whether you do something with or not. The very high-risk people, you need to intervene quite substantially. In the moderate risk guys, you do something with, but you may not do as much as with the high-risk guys. So you have to rank people in terms of their seriousness, and then provide the most interventions to the highest risk people. One of the, I guess, learnings from this is interventions to the lowest risk people are either do nothing or are counterproductive. And particularly in the area of sexual offending, it's really hard to say something like, this is a low risk sex offender. Well, there are low risk sex offenders, and I think they should be treated as such. I know that the Correctional Service of Canada, for example, has a sort of a low, moderate, high classification, and a significant proportion are classed as low. And what that means for them is they're not really treated as sex offenders. They're not provided sex offense specific treatment. They're treated as regular offenders, and they just go about their business. So you don't need to intervene with all people who've committed a sex offense as sex offenders in order to effectively address public safety. For many people, their risk is so low anyway that any interventions will likely just make them worse. For the group that is higher risk, then interventions can work. Now, this is a small group, and we can identify them using currently available technologies. And for this group, you need to address their criminogenic needs. This is the need principle. So what is it that leads them to offending? And I'll talk more about that with sex offending in a moment. And how can you make changes in those in ways that will reduce their likelihood of subsequent reoffending? And the third principle, which is also important to remember, it was referred to as responsivity. And what we're talking about here is that you tailor your interventions to the language and learning style of the individuals that you're working with. So if you're working with somebody who is, Spanish speaking, give it in Spanish if you can. If you're working with people who, in Canadian context, Indigenous backgrounds, give some Indigenous symbols. Talk some Indigenous, talk in a way that makes sense to them. Adapt and if they're use their learning styles and work with them and try to connect with them, and that is the basis of effective. If you're trying to impose interventions on people, you're not going to win. You have to sort of bring them along. You have to bring them in. They have to see how the intervention is actually helpful to them. Another thing which is worth considering in terms of the criminal justice, and I guess this is a subsection of risk isn't static. So risk applies to a person at a particular point in time. And the highest risk period is just after being convicted or released into the community. So these are the times when people are most likely to reoffend. And the longer that individuals remain offense-free in the community, the less likely they are to do it again. And within a particular period of time, that risk declines predictably over time. And after various periods of time, they are no more likely to reoffend than other people in the community. Now, as it turns out, for people with a sex offense history, most of them will have returned to sort of a baseline, very low risk level after about 10 years. And the highest risk guys, they'll go down to this baseline level after about 20 years. And you can sort of calculate this based on initial risk levels and the amount of time free. We've got methods for doing that. And what this means essentially is there's no such thing as lifelong risk among people who are able to remain offense-free. There are, a very few people who are lifelong risk, but they're usually in jail most of the time. They're reoffending, right? But if you're able to remain offense-free for a significant period of time, then you're able to, your risk predictably declines. And I think this is important for all sorts of policies. Much of our policies that we constructed in the 1990s in many countries, including Canada, UK, New Zealand, and Australia, and the US, were based on I think a false assumption that everybody who committed a sex offense was a lifelong risk. And that just empirically isn't true. Some people are risky at that time, but if they can remain offense-free, and if we can help them remain offense-free, they don't have to be a risk later. I got into the sex offending business, so to speak, because I was originally working as a clinical psychologist with people who had came to psychiatric clinics with problems of typically anxiety, depression, worry, and life adjustment problems. And in many of these cases, these were women. And in many cases, these women, when they tell their life story, had histories of sexual abuse. And so my interest, and this was the early 80s at the time, was trying to figure out what caused men, in this case, to sexually abuse women. If we could stop that, then we could make the whole society a lot safer. So whether ending up treating individuals in psychiatric clinics for various forms of, childhood trauma, we could be, preventing or creating societies where this is less likely to happen. So I spent a lot of time looking, and I've spent 30 years or more looking at the characteristics of people who commit sex offense, and particularly at the characteristics of the people who repeat their sex offending, who don't stop. And these are the factors in the highest risk cases. And so I'm going to say a few words about what these risk factors are and what we could potentially change to prevent people from developing these types of factors, and ways of making our society less prone to sexual abuse. So one of the dominant ones, a risk factor, is the lack of concern for others. So this is people who don't care about themselves. They treat others in a particular way. They often form an in-group and an out-group, and the out-group are people who they feel they're quite comfortable being callous and indifferent to, and they may have a very small in-group which they protect. But there's a very strong differentiation between people who are they're able to be nice to, so to speak, and those who can be cheated, abused, assaulted, those sorts of things. And the opposite to that, what we want to foster, is sympathy and caring. And so there's formal programs you could implement in schools for doing this, but there's also, just as a society, how we interact with each other and what we tolerate. When we see somebody being mean to somebody else, do we intervene and say, that wasn't very nice? And I think we can all be nicer in this way. And I think there is some responsibility for each of us for messaging, is to be kind and to realize how our behavior could be harmful, and to try to moderate it to be more helpful. So generally fostering sympathy and caring as a value throughout the lifetime is something that would reduce crime in general, and sex crime specifically. A related issue is decent friends. When you look at people who sexually offend and continue to sexually offend, they hang out with other people who aren't very good influences. They often have criminal records. They often have attitudes that support and condone sexual offending. They often lead people astray in various ways. And if you develop better skills at dealing with people, and if you're able to sort of be nicer, you're able to develop these networks of more pro-social influences. And I think that's something that we should, pay attention to and support. And I think things like there's youth programs, for example, that that support athletics. So people in high-risk neighborhoods, they could be involved in athletics that could potentially get them associated with more pro-social influences, and to have these types of things that I think we should be thinking about. For sex crime in particular, a very common risk factor is hostility towards women. And women are treated as, property, essentially, and they are treated as objects. And this is not subtle. There's no shortage of things on the internet these days about treatment of women as literal objects. And this stuff we need to sort of socialize out of our children and out of our society as much as possible. This is an ongoing thing. I think we've made some progress, but I think there's still a lot of progress to do. One of the, suggestions, and one of the problems where it arises is highly sexist attitudes tended to develop when boys and girls are separated. They don't interact with each other. And you often see it in like sports teams. I know Canada has a problem with the elite hockey players getting involved in very sexist, abusive behavior. And if you can think about ways of integrating, boys and girls, men and women into things, you tend to get less of this overt sexism happening. Another area which is important is, a risk factor is impulsivity and poor cognitive problem solving. So people commit crimes and sexual crimes. Often it's against their best interests. If they actually thought through it, this isn't a really good thing to be doing, but they do it anyway. So we should encourage, general self-regulation strategies, things like education, more generally, and teaching, problem solving and solutions by reflection. So, if you have a problem, don't just act out or, do a violent act. Think about it. How do you think about your problems? These are, it seems very simple, and most of us, who are reasonably well educated have done a lot of this, but it's something which is actually, valuable, and it's something that we should encourage in others. So we should encourage patience and reflection. And I guess more specifically, there's one area where we could pay more attention, which is specifically the use of alcohol amongst young men. In many cases, use of alcohol is disinhibiting, and it's related to large numbers of antisocial and destructive behavior, including sexual assault. And I think there's a real opportunity here to sensitize young men about the risks to others of the use of alcohol, as well as their own risk to themselves. And I think that's something that we could do a lot more with. I'd be remiss to talk about sex crime without talking about sexual self-regulation. Sex crimes are sexual. They're not just crimes, but they are sexually motivated. And a lot of the people who commit sex crimes, what I would say, have problems of sexual preoccupation, and they sort of overvalue sex in the pursuit of happiness. They do a lot of sexual things, and they do them even when other people don't want them to be doing it. So one of the things that we want to develop is a sense that a better sexual self-regulation, so that sex becomes, I'd say, less of a big deal, and it becomes more socialized. People have problems with sex when they separate sex from the relationships. There is some separation that we all sort of do, but sex within the context of relationships and caring tends to be unproblematic, whereas sexual behaviors that are impersonal are the ones, high rates of impersonal sex essentially are associated with all sorts of problems, including sexual offending. So that's something that we need to pay a little bit of attention to. There are as well a small number of individuals in the general population who have atypical and problematic sexual interests. So we have people who have things such as sexual interest in children or pedophilia. We're not sure exactly why, but they do. And it's something which tends to be a relatively enduring trait. Having a sexual interest in children or some other atypical sexual interest doesn't mean you'll act on it. And the factors that determine whether people will act on that or not are largely based to the same things where people will do any sort of crime. There's all sorts of things that we want in life, which we don't go and get because they're wrong. And the same way that people who have sexual issues with children can recognize that it's wrong and that they don't want to do it. And I think we should be supportive to those. And there are some initiatives like that that allow individuals who have atypical or problematic sexual interests to seek help. And I think we should be encouraging of those types of activities. I'm going to end with a little bit of a thought experiment here. And this is, the thought experiment has to do with the costs of incarceration. So criminal justice responses, we have them. I think we should have them, but how much should we have them? Right now, criminal justice is paid for by the government, or incarceration specifically, and nobody really sees the bill. You can line it up occasionally in an abstract sort of way, but you don't actually pay it, right? If you had to pay it, how much would you actually pay to put somebody in prison if it came out of your pocket? And this is like in Connecticut, for example, I just looked it up just before this meeting. The annual costs of incarceration is $62,000 a year per inmate. That's a fair chunk of money. That's like almost as much as many people make in a year. So it's something. Now, just imagine, just as a bit of a thought experiment, say a guy goes to jail, and after a year, goes to jail for a sex crime. After a year, you go back to the person who was the victim of the sex crime and say, look, it cost us $62,000 to keep this guy in jail. Now, what about we could give this money instead to, say, victim services? Would that be a good idea? Fine. What about we just gave it straight to you, right? And you put it on the person saying, look, would I be prepared, is it worth $62,000 to me to have this guy in jail for another year? We never pose those sorts of questions, but fundamentally that's what we're doing. We have to pay for it. Somebody's got to pay for it. It's not free, but what sort of benefit do we get from it? And is it $62,000 worth? And I think that's something that we sort of need to consider. And framed in that way, I think there's lots of things that we could do with that money that would make a much safer society, or even fix the potholes in the roads. I think that's ways of dealing with that.